Hi everyone, welcome to Centralia Elementary School District's Wellness Wednesday Parent Workshop. I am Dr. Stacy Chang, Director of Parent and Student Engagement, and today I am here with Ms. Karen Leal, our district social worker. Today's parent workshop agenda is as follows. We'll be talking about COVID-19, how to talk to kids about COVID-19, and helping kids handle worry. Now, this is just a quick fun activity for us. How are you dealing with COVID-19? I love the expressions of Lucille Ball. Back in January, we thought, ooh, 2020, brand new year. We were so excited for the new year. And then come around February, we hear about the novel coronavirus, and March hit and then we had to go into school dismissals and closure of businesses. And then April, May, June, July, August, and now we're in September. Hopefully that's not you, but let's check in and see how you are dealing with COVID-19. So in the chat box, if you will write the number that matches how you are dealing with COVID-19, how you are feeling these days, we'd appreciate you sharing this with us. Okay, I see a 1. We have a parent dealing with COVID-19 quite well, maybe because we have adjusted to everything that's going on. It's been quite some time. You are safe, so you are still happy. I see a number 4. Oh, yes, it's still there, and a lot of 5s as well. Okay, I see 2s and 3s. Thank you. Thank you for sharing with us. I do not see any number 9s or 8s, so that's good news for us. We are dealing with this to the best of our abilities. I'm glad to hear that. I wanted to share with you that Centralia Elementary School District has a school reopening and safety plan. It was initially board approved on August 5th, and due to the additional guidance that has been coming out from the state and Orange County Healthcare Agency, we've updated our safety plan. And this reopening and safety plan will be posted on our district website, and then our site-specific plans for health and safety protocols for each of our schools will be posted on each of the schools' websites, so you will be able to access those. Our school principals have been holding parent meetings, coffee chats, and then even creating videos of the site-specific plans so that they can share the specific health and safety protocols with you for in-person instruction. In our plans, we have procedural operations for each one of the day-to-day operations, starting from the multiple points of entry for arrival and dismissal, our active temperature checks, breakfast and lunch, as well as staggered recess and other areas of the day. I wanted to make sure everyone was aware of the COVID-19 symptoms. This is a beautiful graphic that Orange County Healthcare Agency has posted on their website. We have COVID symptoms including cough, fever or chills, headache, fatigue, shortness of breath, sore throat, nausea, vomiting, diarrhea, congestion or runny nose, new loss of taste or smell. And understanding that this is not the entire list, there could be other symptoms, and symptoms can appear 2 to 14 days after exposure. So if you develop symptoms, we are asking you to please stay home so you don't infect others. You can monitor your symptoms carefully, and if symptoms get worse, please do call your health care provider as advised by CDC and the healthcare agencies. For emergencies, of course, call 911. There are free COVID-19 testing sites that are available, and we have been posting that information for families and staff on our peach jar, as well as emailing it out. If you think you or someone at home or work has COVID-19 and you would like to get tested, you can visit the ochealthinfo.com COVID test website as well as our Peach Jar to find out the locations. There are also COVID-19 resources that are available for you. And for more information on getting food or jobs or paying rent or getting medical care, you can also visit ocgov.com for those resources. We do have resources at our own Centralia School District's Neighborhood Resource Center. So if you need assistance finding resources, please do reach out. And then there are additional COVID-19 information on the Orange County Healthcare Agency as well as Centralia School District's website as well. There are specific strategies that are recommended for the stopping of the spread of germs, and you can help prevent the spread of respiratory diseases like COVID-19. This is a poster that we have at all of our school and district sites. Just as a reminder to everyone to, number one, stay at least 6 feet from other people. Keeping your distance is key. Number two, cover your cough or sneeze with a tissue, then throw the tissue in the trash and wash your hands. Number three, when in public, wear a cloth face covering over your nose and your mouth. Number four, be sure not to touch your eyes, nose, and mouth. Number five, clean and disinfect frequently touched objects and surfaces. Number six, stay home when you are sick except to get medical care. And number seven, wash your hands often with soap and water for at least 20 seconds to ensure that you are washing away the germs. This is a COVID-19 student symptom decision tree that we received from CHALK and OC Healthcare Agency. And this is a chart that we will be utilizing to help us make decisions about when to send children home. You can see the low risk and high risk symptoms that are listed for you there. And then when there is exposure to COVID-19, or possible exposure to someone with a positive COVID-19 case, then these are the different steps that will be taken. It's important to note that close contact means less than 6 feet and for 15 minutes or longer. That's what we mean when we say you have had close contact with somebody. And so if there is one low risk symptom, then we would send the child home, and the child may return to school 24 hours after the symptom resolves itself without fever reducing medication. If there's more than 2 or more of the low risk symptoms or one of the high risk symptoms, we would send home and we would ask that the child be evaluated by a healthcare provider. And then there are specific steps if the healthcare provider confirms an alternative diagnosis or for symptoms, and then the child can return to school 24 hours after, just like before, without fever reducing medication. If it's a negative COVID test, then they can return to school after 24 hours without fever or symptoms improving. If there's a negative, if there's a positive COVID-19 test, then the child can return to school only after 10 days since the symptom onset and 24 hours without fever. Though you would quarantine close contacts of confirmed cases, and this will be with the direction of the healthcare agency or the healthcare provider. And if there is a positive case, you would stay home, return to school after 14 days from the last contact, unless symptoms develop. And if symptoms do develop, then you would want to get a COVID testing for that. We do have CESD health and safety videos that we have created. Our district nurses have created hand washing videos for our students and staff and parents that are posted on our district website. And then how to wear your mask. They go through specific steps on how you should be handling how you wear your mask and how you should take care of your masks and how you take them off. And as a reminder, our Wellness Wednesday parent workshops have been recorded and they are posted on our district website in our parent training website pages. And then this one will also be added to the parent training website as well. Now we will transition to the mental wellness portion of our presentation. Karen, it's all yours. Thank you.
Welcome. I'm so excited to talk to you guys about this issue. Experts in the area of mental health and behavioral sciences think that this is a very particular time. We know that kids are going to be returning back to school and it's going to look a little different. So normally as parents, if it was a normal school year, and again, it's already not normal because we have back to school again, right? So some of us already started, the kids already started with the virtual learning, and now some will be transitioning into the in-person. And so it's all over again, back to school. Normally, as parents, if it was a normal year, we're making sure that our kids have their school supplies, their new shoes, maybe the backpack, the clothing, and the haircuts. So making sure they have all the essentials. But the experts really think that one of the most, even more important than those school supplies or those essentials, is that our children come to school with the ability to be able to calm down, relax, and just have a skill set of not letting stress or fear or anxieties kind of get in the way of their learning or just being comfortable at school. And so these are things that are just really important, and we'll be talking about today as a parent how you can teach and support your kids so they're able to do that. Also, I want to keep in mind that things are going to look different, and they're not going to return to a classroom that looked like before they left. There's going to be masks and social distancing. So we'll talk a little bit as far as how to transition and support them in those changes. But it's also quite possible that children are going to return to school just excited and happy to finally be back at school. So just keep in mind that these suggestions or ideas or tips are things that are going to help them through life. So even if they're stressed out about taking a test or doing tryouts for music or sports, or as they transition to junior high or high school. So these are just life skills that are going to be able to help them throughout their lives. Next slide. So every time we talk about supporting children and their anxiety and managing fears and helping them relax and be calm and manage stress, we always have to talk to parents about how they're managing their stress, how they're taking care of themselves. So keep in mind that the parents are always the first teacher in the home, the most significant. And so they're learning from you. If they see how you manage stress, that's how they're gonna learn how they're gonna manage their own stress. Another thing to keep in mind is also just the energy or the vibes that they sense from their caregivers, from the adults in their home. Even if we're not saying anything, if they notice or sense that we're tense or nervous, those are energies that they pick up on and they absorb and they soak up those feelings. So we just have to be really aware and conscious about how we're feeling and making sure that we're taking care of ourselves, that we're doing what we call self-preservation, because we're going to need that energy to be able to support our kids emotionally, but we're also going to be modeling and showing them how we're doing that. So here on this slide, this is a newsletter that I really enjoy. They email tips for parents on how to They call it the mental health update, and there's tips on how do we promote wellness and health in our children, and there's a lot of tips for too as parents. How can we take care of ourselves so we can be there emotionally for our children? Next slide. So keeping in that mind, we have to make sure that we're taking care of ourselves, that we are not letting stress or anxiety or fears overcome us. It's really important that we practice these strategies. This is through the California Surgeon General's playbook. It's stress relief for caregivers and kids. So keeping in mind that just we want our kids to be able to reduce their stress, we also want the caregivers. And so here there's a lot of research and science behind how physical health and mental health are very much interconnected, intertwined, meaning if we're not emotionally well, if we're depressed or anxious, then our physical health is compromised, and vice versa. If we're not physically well, our mental health is compromised. So here there's a lot of science and a lot of research behind that. These are the strategies that can really help with managing stress. We call it a stress reduction diet. So it's not a question of, just one time I go ride my bike and I'm going to be stress-free. It's really about a lifestyle and just incorporating these things into our daily lives as caregivers and promoting that for our children. This playbook is at no cost. It's through, like I mentioned, the California Surgeon General, and it's also available in Spanish and Korean. So if, you're able to click on these links and access that information. And these are just quick tips, but want to make sure that you guys take the time to just really practice these things so you can, again, be there for the children emotionally. Next slide. So as adults, we really do have a role on how we can support our children in managing their fears, their anxieties, keeping in mind that, we are living in a time that's very new to all of us. We haven't gone through this before. It's a pandemic. So naturally, these feelings are going to be very normal, very natural, because it's a situation that's very abnormal. So one, we just want to say that it is normal to have these feelings, but as parents, we can support our kids in managing these feelings, and again, not letting these feelings get so big that they're not able to do things. Like, for instance, they're not able to go onto campus, or they're not able to sleep or eat. So those are the things that we want to help them in managing it, and not letting it interfere. So as adults, what we can do is, one, being honest. So having conversations about how serious the situation is. Again, we don't want to scare or alarm them, but we also want to be honest. We don't want to say, it's not a big deal. It will pass over next week. School's going to be normal. Everything's going to go back to normal. And yes, we can be hopeful. And I know as a community and as a school, and there's so many medical professionals working on making things normal again and making sure that we're all healthy, keeping in mind that it's going to be a lot of work and there's a lot of practices that we have to incorporate. So we want to be honest, we want to be accurate, and make sure that we're giving our children accurate information. Again, the point is to help them minimize the fear or the anxiety, but also keep in mind it's not our job to eliminate fear and anxiety. Fear and anxiety and stress can be very, like I mentioned before, are very normal and natural feelings, but they can also serve us very well in the sense of having a little bit of fear or anxiety about COVID-19 is okay, because it is a serious situation, and that's going to prompt us to make sure that we're taking precautions and that we're being safe. Just like having a little bit of fear and anxiety before a test is going to drive that child to practice, make sure they study, and to make sure that they're taking things seriously. And so a little bit of fear and anxiety is okay. It can help us, and it gives value and purpose to what we're doing. So our intention as adults is, not just say, oh, get over it, it's not a big deal. It's just, how can we help them work through it so it doesn't get too big? Next slide. So the way that you can do that is one, having conversations, and specifically conversations about COVID-19. So again, first you want to make sure that you feel calm, that you are able to manage your own fear or your own anxiety about COVID-19. And as parents, we might be having that. And then also we might be impacted by it in so many different ways, whether it's we've lost a loved one, or we've been impacted in our employment, or our housing is jeopardized. And so those are things that we want to make sure that as adults, we're working through that, getting our own assistance, our own support, so that when we have conversations with our children, it's not our own fears or anxieties taking over. And those are very normal and natural feelings. We want to provide a reassurance. So again, letting them know that it's okay to feel nervous, it's okay to feel scared, that it's natural, it's normal, and that you're here to help them work through that. You also want to make sure that you're listening. And listening really means, what is it that they're fearful or they're anxious about? So as parents, I imagine that we all have our own fears and anxieties of what we think our children might be going through. So whether it's those missed opportunities of learning, whether it's those missed opportunities of socializing, and so those might be our worries and anxieties, but our children might be experiencing other worries and anxieties. So an example of this is my 4-year-old. Her stress is really about not being able to see one of her best friends. And so she talks a lot about her best friend. She mentions her by name. She talks about she has a desire to have a sleepover, and she talks about wanting to spend time with her and wonders what she's doing. So hers is really centered on experiencing that loss of that relationship or that friendship. My son, who's 6 years old, his is more about right before the stay-at-home orders and before Disneyland closed, we had planned a trip to Disneyland, and we weren't able to go for other reasons. But by the time we went to reschedule or look at other dates, Disneyland had closed. So his fear and his anxiety is more, or his feelings of lost is more about that experience, that opportunity to be able to go somewhere and do things. And so again, it's going to be very different how they're reacting and what they're anxious or nervous about, or what they're even sad about. And so we really want to make sure that we're listening to them. The other component to that is, you'll be surprised how much information the children already know. And so really asking them, what is it that you know about COVID? What are your thoughts about it? And then that can give you an opportunity to give them accurate information, correct information. They may think, oh, everyone who gets COVID-19 is going to die. And so that's an opportunity for you to give them correct information, that there is risk, medical risk and health risk, but most people are able to survive it. And again, just making sure you're giving them the right language and the right words. And I'll give you an example of specific words that you can use. The other thing is, you really want to refrain from avoiding blaming or using any language that might be stigmatizing. And so that's something that's just not helpful. When there's stress, when there's fear and anxiety, if we put blame, if we put stigma, that's just going to make the conversation more emotionally charged, and that's just going to add more anxiety, more fear, more stress. So we don't want to contribute to that. And again, especially considering our younger children. Now, it might be appropriate to talk about the political climate, and definitely for our older adolescents or young adults, they're going to be participating maybe in their first election. And so it's an opportunity to talk about advocacy and, their opportunity to vote. And so those are conversations you may have with the older teenagers, young adults, but definitely for our little ones, we want to protect them from those conversations and just that climate, because it's not going to help their fear and anxiety. It's going to make it bigger. The other thing you want to consider, I talked a little bit about my children and their personalities and just the values that they have. You want to also just consider their age. So again, the conversation that you're going to have with a 3-year-old is going to be different with what you have with an 8-year-old or with a teenager. consider that they have different vocabulary. They process information differently. A teenager has the ability to be more analytical, analyze information, have more of that higher processing, being able to process information, abstract thinking, meaning being able to think of things that are not really there. Whereas the younger kids, the little ones, are more concrete, and they can only really think of physical things versus things abstract. And also you want to really focus on the empowerment. So yes, this is a serious situation. We have to take it seriously, but these are things that you can do to help stay healthy. And these are things that you can do to help others people be healthy. So by wearing your mask, you're making sure that you are keeping your germs and not sharing them to others. So you're helping yourself, but you're also helping the community. You're helping your peers, you're helping your teachers. And so really focusing on what are the things that are within their control and how they can contribute to just having a healthy community, a healthy classroom, or just a healthy household. Next slide. So again, going back to just the media and exposure, you want to make sure that we really limit the amount that the kids are being exposed to, just because it's very emotionally charged. It's a lot of information. If you hear over and over again about deaths and just very serious matters, again, that's only going to fuel and make the anxiety and the fear bigger. And also, it's not just television, but now it's the social media, right? It's the YouTube, it's the Facebook. There's just so much stuff out there. And so we really want to make sure that we're protecting our children from overexposure or exposure that can be exhausting and just too much. And also keep in mind, I know a lot of us, maybe our quarters are starting to feel smaller and tighter. We're spending so much time at home. So even if the child is not watching the television, but they can hear it, even if they aren't in the same room, if they're in a room, in the other room, if they can hear, or, you know, especially those significant words like death, or scary words that they themselves may not make sense of it, it can be very scary. The other thing to consider is just even casual conversations that you can be having with significant others or other adults in your household. Again, even if you're not directing the conversation at your child, they can be overhearing that. They're little antennas, and so they're picking up on things. And also the conversations on the phone, right? And so those are things are just to be really mindful of and just be really protective, because our kids, as is developmentally, are starting to make sense of things, and so they might misinterpret or again just become overly anxious if they hear certain words or terminology. Next slide. So I know I'm saying a lot, say this, say it like this, try this, but overall, just you want to keep it simple and just let them know that the school officials and health officials are working hard. They're really working together to keep everyone safe. And so every consideration, every decision, the discussion centers on what is going to be safe for everyone, and everyone's working together really hard to keep them safe and the community safe. And so just provide that reassurance. Next slide. So again, here's just some very specific language that you can use. I'm making sure, being concrete, this is what COVID-19 is. This is what scientists and doctors are still learning about it. So you're being accurate, you're being honest. You know, we don't know everything, but we do know something. So what is it that we do know? Who can get COVID? What are some good practices to help protect you, protect others? So this is very specific language that you can use with children. And then again, you do want to address, you know, what happens if you get sick, that there's going to be doctors and there's going to be people there to help. Next slide. So again, one of the biggest things that's going to be different for our kiddos when they start school is the having to wear masks. So they're going to be wearing masks. The staff is going to be wearing masks. Their peers are going to be wearing masks. So we want to make sure that we're having a conversation and we're really preparing our children for this, because this is going to be the first time that they go to school and have to wear a mask. So the biggest thing that you can do to help them, prepare them, and just get comfortable with it is to take the time to have them put on the mask and look in the mirror. What does it look like? What does it feel like? And have a conversation with them. You might also want to wear a mask and start having conversations. What is it going to sound like to have a conversation with you wearing a mask and another person wearing a mask? So the intent here is just to really get them used to, as much as possible, having the mask on, which it might be something very foreign to them. You also can practice, especially for our little ones, putting the mask on stuffed animals. That can be helpful. So again, really the point is to get them used to it, to help them make it feel normal and natural and just an adjustment. You can also try giving some sort of autonomy or some sort of choice. So for instance, you can say, do you want to wear the pink mask or the one with the yellow flowers? And so that way they kind of have some ownership or a choice, that they're able to make a selection. Again, something that is within your control. Let's see, you can try decorating them or personalizing them, or even if there's, I know I'm starting to see a lot of like action figure masks, or I've seen some Trolls masks. So my daughter right now, she's obsessed with Trolls, the movie. And so when I showed her the mask, she was so excited to wear something that had Poppy on it. So again, just trying to find something that they're able to have an interest in and they can associate with. You can practice drawing them on their favorite characters. The most important thing is we really want to avoid them going back to school on the first day and have it be the first time they wear a mask, and have it be the first time that they wear it for so long. So again, as much as possible, if you're able to practice this at home and for longer, maybe start off short durations and move on to longer durations so that they can get used to it, and have it just be a natural and normal feeling when they go to school and not have it be the first time. Next slide. So again, part of the mask wearing is also really conveying to them the importance and why they have to wear the mask. So taking the time to explain it. And again, to provide that honest, accurate information. And also that notion that they have a responsibility to be healthy and for the health of others. And so again, the words or the way we explain it is going to be different depending on the age of the child. So for children under 3, it's going to be, you're going to keep your germs and you're not going to share the germs. So very concrete, specific. For children over 3, it's going to be like, oh, we have germs, they're so small, you may not see it, but this mask will help protect it. So again, here's just some suggestive language or words that you can use to describe and really explain to the children why they have to wear a mask and why it's so important. We're not trying to stress them out or have them be scared that, oh, you dropped the mask and something's gonna happen. It's just explaining why we have to do this, what can we do. If you do drop a mask, this is what you can do. So again, just have that explanation, the information, so that they feel confident and comfortable with the mask. One thing to consider for our older children and our preteens, it's really about, they really don't like being singled out. They really like just kind of looking like everyone else or being like everyone else. So it's going to be helpful, the fact that all their peers are going to be wearing masks and their teachers and the staff, so that it's not any one person being singled out. Next slide. So we talked a little bit about the mask wearing, but another big thing that's going to be different is social distancing. And so that might create some nervousness or, they're unfamiliar with that. But whatever stressful situation that may arise, again, they might go back to school and they're just so excited and happy, and that's okay. That's going to be good, right? But just keeping in mind other stressful situations that may arise. This is an exercise, or this is something that they can do for themselves in the moment to help relax, feel better, and just feel calm. And that's what we want. We want our kids to be at school calm, relaxed, so they are in their best position to learn and form those relationships, those connections with peers and with the teachers and the adults. Now I'm gonna ask again, remember I talked about how as adults, we're really teaching our kids by example, by modeling. So I'm gonna invite you to practice this exercise alongside with me so that you can get familiar with it and you can experience it for yourself, and maybe you can show your children by modeling it. So again, this is something that can be helpful for kids, for adults, and for anything that might create stress or anxiety, or even if we're just tired. These are things that will just help elevate our mood, our energy, and just feel good about ourselves. So this is a 5-step exercise, and there's going to be 5 different techniques that we are going to be using today. So next slide. So the first thing that we're going to do is we're going to have thoughts, right? And we're going to stop those thoughts. So for example, I'm having thoughts as I'm speaking to you here today. Some of those thoughts might be, you know, is this making sense? Am I talking too fast, too slow? Is this information that's helpful? So I'm having these thoughts, right? And I want to notice them. Notice them and then connect it to, what is that doing to you physically? I'm feeling maybe a little bit of butterflies in my stomach. I'm noticing my forearms are tense. My breath, I feel like I'm a little bit short. So you really want to pay attention to your body. What is it feeling? And be really mindful of what are you sensing. Next slide. Then you want to name it. You want to name this experience. You want to name those thoughts. You want to name those body ailments that you're having. Like, what's causing it? Is it nervousness? Is it stress? Is it insecurity? So you want to give it a name and just really acknowledge it. And what is it that you are feeling? Next slide. Oh, sorry, if we can go back. So one thing to also keep in mind is our young children, they're starting to develop language and vocabulary. So they might be having these feelings and not know the name of it. So that's why it's really helpful to provide visuals or examples and really give them the terminology, or, you know, this is what happy is, this is what sadness is. So we have to sometimes teach them the basics so that they're able to express that and make sense of what they're thinking and what they're feeling. Next slide. So now you have all this going on inside you. You have those thoughts, you have the feelings, you have these physical ailments going on. And now what you want to do is take it outside of you and just be really mindful of what you're surrounded with. So the first thing is really taking the time to see what is around you. For the little kids, I'll have them pick one thing that they see and describe it. What color is it? Is it shiny? Is it dark? You know, if it's a piano, how many keys? What are the colors? Do you notice the light shining off of it, right? For the older kids, I might actually have them name 5 things that you see and describe them. So they might have the ability to provide more attention and focus, whereas our younger kids are very short in their attention span. So whatever works, and whatever works for you as long as it's grounding. So you'll look around you, and so right now what I'm looking at is a silver doorknob that's dull, it's not shiny, and the lock is going up and down. I had to lock it because I wanted to make sure that I was focused on you guys and I wasn't going to be interrupted by my dog or other people in my house. So I'm being mindful of what I'm seeing. The next thing is you want to be mindful of what you're listening, what you're hearing. So right now I hear the buzzing of my air conditioner going off. And so just being aware, what is it outside of you? The next thing is smell. Is there a smell in the air? Are you smelling something? As I move my hands, I can smell the sanitizer. I use it like 10 times a day. So it's a very strong, familiar smell at this point. The next thing is taste. Can you taste something? Is your mouth dry? Are you thirsty? Did you just have lunch? Are you chewing gum? So really taking the time, what is it that you're tasting right now in the moment? And then the last sense that we want to check ourselves with is touch. If you can find something and just touch it and really take the moment, what does that feel like? So right now I'm touching the little armchair. And so I'm noticing that it's kind of grainy. It's not cool, it's not cold. And again, just really taking the time to experience that sense of touch. And what this does physiologically, it just really helps decrease our stress. It helps calm us down. I know I feel more relaxed. And the next slide. So the last step is